All right. All right. Um, Today we are blessed to have Leon Fulcher among us for this meeting. He has a MSW and PhD um, in over 40 years of experience here in social work and child and youth care field in North America, Europe, and Middle East Africa, and Asia. For a decade, he chaired the board of governors for the International Child and Youth Care Network at www childandyouthcarenet.org. That's where you find it. Amongst his many esteemed position has his position as a childcare consultant to Her Highness Metha bint Mohammed bin Khalid Al Nahyan in United Arabs. And Leon has supported South African child and youth care sector over 2 decades through the training and publishing holds position of child and youth care consultant and transform outcomes international. So that is the background that we have on Mr. Fulcher Day. Thank you, Chair.
Thank you very much. Leon, we then hand over to you to share with us. I will you slide reflect your slides here on the screen.
Okay, kia ora tātou i hui hui nei. Greetings to you all who have banded together across South Africa. I love the idea of groups watching together, but to begin to think about this notion. So kia ora and greetings in the Maori sense of this term. Also Eid Mubarak to Salam Alaikum, those who are coming past the time of Ramadan and also in the celebration. And to that extent, I would like to pause for at least 10 seconds to think about the starvation of children in Palestine. And that there's so much we have to do to bring more peace into our life, where you are, where we are, and in the places that we can influence. Now, I've had arrangements for you to have this article from the British Journal of Social Work in 1981. I know you're all into this continuing professional development, and I really support that. I don't expect that you will have read and are going to be tested upon this long journal article in the next day or two, or even in the next week. But it may be one of those things that you carry around with you, and every now and again think about some different aspect as your practice day to day may hit you with something that leaves you frustrated or trying to work out what's going on here. So I'm going to quickly just walk through the 12 variables that impact on your job, whether you stop to think about it or not. And I reckon that the more we think about these variables and how they influence our work in our place with the young people who deserve the best we can offer them, then that may help us to be responsive in a more genuine way and to create opportunity moments that matter for children and young people. So the first one, it's a little more complicated than some, but it's the idea that there is a social and legal mandate to deliver services. So your place is given authority in law, or sometimes not law, but values. An example might be a children's home might have been created by someone who had room in their house and they agreed to take on children. That's not a government mandate, whereas the others might well be a place of safety placement which is this child is placed within a legal jurisdiction to be there. So every service has a legal mandate, a social and legal mandate. And it's important to work out how you describe that, how it's emphasized in your day-to-day work. The second variable is really much more practical, and it's the siting and physical design of the center. So what's the center look like? Is it a center that is created by a special purpose-built facility? I've heard people talk about sometimes having a purpose-built facility with the wrong purpose. Or is it an adapted building so that it's adapted from an old household for a family, extended family, or it might well be a business property that got turned into something else. I visited a place one time that had been a pub before it was turned into a youth center for young people. So siting and physical design of the center, how do you get there? How can a young person for the first time find their way there? So we're going to come back to this one and spend a little bit more time once we've gone through them. So that's one I want to flag. Imperative variable 2, siting and physical design of the center. Third one is the personnel complement and deployment of staff. Now, I admit that's big words to use, which is basically how many people are there that work in your center and how are they spread over the time you need them? So that's what deployment and that idea, how many people are there? And that really is a major issue for the way the service happens. And so we'll come back to that's the second one we will look at when we come back. The fourth one is recurring patterns in the use of time and activity. Now, for example, I should have said good evening to you, but for you it's good morning. So that already there's a time influence on how we use the time and activity available to us. The issue of workday, weekday, weeknight, weekend are examples of recurring patterns in the use of time and activity. And so finding your way around how are the 168 hours of residential care explained, what happens in them, or if it is a day center or a day service, when it's open, what are the hours that it's open and how does it respond to community need? So we'll come back to that. The three that we're going to come back to are siting and physical design of the center, personnel complement, and use of time and activity. The fifth variable has to do with admission and discharge practices. The basic issue is that every service you're in gets new people and people leave. And so whether it's a residence where we get admissions on the same day every week, or could happen at any time of the 24-hour period. And in the same sense, are the discharge processes planned and worked out, or do children or young people run away to get away? And these are also some of the practices that you might find. So fifth one is admission and discharge practices. You'd want to think around how does your service deal with those? The fifth one is social customs and sanctions. Now this is got to think about this idea of customs and sanctions. Customs would be what happens on a Sunday morning in your place, or what happens on a Saturday or a Friday, because what happens around the customs and practices that go on there would often be framed by religious practices. If it is an Islamic center, it may well have 5 periods of prayer each day. These are social customs and practices. And the same way, sanctions are built in. What are the rules? What happens if you break the rules? Interesting one I came across in Scotland was that everybody had to sit together for dinner, evening meal, and the last person to finish their evening meal was off meals for a week. Now think about that. It punishes you for taking your time eating and having conversation over your food. I spoke with a young person who became a young adult when I met him. He said, what happened is it taught us to eat quickly. And so we don't have time for conversation. And people who've grown up having conversation over dinner just didn't fit. So customs and sanctions. What are the things, how are rules enforced? What do we do? And whether we do it or not, I hope we're not using food as a punishment. So we'll come back to that, please. Variable 7, the social climate of the center. Now, this gets really quite complex until you think about if you come to the work in your center after you have been away on sick leave, there's a whole piece about how the climate of the place has adjusted without you and how you're welcomed back in or not. So there's a whole dynamic of the climate. Is it lots of joy and laughter, or a lot of frowns and silence? And these are really important notions around this social climate of the center. And we need to stop and consider how that is and how we're using it. The 8th variable has to do with links with family, school, and community. Every child or young person coming into our services, especially those on place of safety orders, have a right to those links with family, school, and community. And sadly, the history of residential care has been to almost lose contact with family members rather than to help maintain and sustain them. Excuse me. So that's one aspect of it. School is another. And we got to be careful that we don't just say off to school, or we've got school, or we're going to homeschool. School has a whole social interaction piece to it that we need to be engaging with to create the opportunity moments that brings a formal learning environment and the social learning environment of living and learning in our place of residence. The community, sometimes we're more interested in having them not have contact with some people in the community. But the issue is they will, and that will happen. So we need to think about how our center engages with our neighbors. And that too is a very important aspect of the practice. Variable 9, criteria used for reviewing and evaluating performance. That applies to the young people in our programs. It also applies to us doing our work in our programs. So evaluation of performance is really quite an important one, and reviewing it together and having the notion of group supervision as well as personal supervision is a very important dynamic for child and youth care workers. Without supervision, we really are allowed to fly by our own guidance, and we're not necessarily part of the same shared practice. So relational practice means practicing relational within the staff group as well as relational with the young people. Variable 10 gets really quite more intellectual in terms of theoretical, philosophical, and ideological determinants of care. I ran across in Europe the Rudolf Steiner people who have a very clear philosophical orientation to the way care is provided. And they have a long history of providing care to a very a challenging young adult group of multiple disabled people. So the fact that whether you have a shared theoretical or philosophical view, every worker in your center carries around in their head a story that says this is the way you do things. And that isn't always the best way to do things. So thinking through and sharing what are the things that we agree to as our mission for this service and how it's responding to the young people and families and community with whom we're engaged. That requires more work than just sitting up there in somebody's head. We do it this way. Number 11 has to do with money. So opportunity and social cost benefit ratios. Ooh, that's big. Lots of big words in there. So what does social cost benefit ratios mean? Or what are opportunity cost benefits? Somebody, they may not be very close to where you work, but somebody in the organizations that employ you, somebody is thinking about how much it costs per hour of service to a young person in your center. And that's what opportunity and social benefit cost issues are. So the opportunity to have safety and security while engaging and completing education is a pretty powerful opportunity cost benefit to the community and to the young persons involved. So there are ways in which we need to think about what are the opportunity and social cost benefits that come from your service. Because if we can't say that, somebody else is maybe working out that it costs too much. And we say that here in New Zealand, where we're just suffering major cuts in our news media and television services. Anyway, that's here. I won't worry about too much New Zealand for that. Last one is to do with the public policy environment and organizational turbulence that's external to the center. Now, I don't think you have to think very long and hard to come up with an external influence that rocked the services that you run. And from early 2022 through the next 2 years, the COVID pandemic had major external influence on the kind of things we can do through illness of staff, through illness with families, whatever. But to think it's a graphic illustration of this variable, that there are things happening outside of our control that are nevertheless requiring us to adapt and do the best we can for the relational needs of this young person. And that's where the thing around organizational turbulence comes in, because another one would be a new government comes in and says we're going to cut 7 to 10% of all public services, and people being laid off and taken out of their jobs, and we're not sure what the young people are going to do who lost their social worker. So there's external factors. That's the ones that we're trying to talk about. The one that I always think is classic for South Africa, think about it, load shedding is a classic illustration of this organizational turbulence that's thrust into that and you've all adapted to it, and you just know what to do. So that's where I'm going to stop for a minute and see whether anybody wants to respond or react to any of that before we plunge back into those three that we identified at the start. How's that for a start? Can I get some kind of indication of where you are with that, if that seems okay?
Are there any questions? I don't see anything in the chat box. Any comments?
Yeah, just a comment, sir. Can you guys hear me?
Yes, go ahead.
Yeah.
Just a comment. I think the variables that you have been now doctors mentioned here. I've seen like in the children's organizations, the child care workers have been like struggling, with the children's behaviors and stuff. I think this webinar today and the information that we're gonna get today, it's actually gonna be a good tool for child and youth care workers actually to be able to manage well the behaviors of the children. I mean, for me, I'm getting goosebumps now with all the information that has been laid down now today to say that this will be a good webinar, and I'm looking forward to listening on what we can get from it, and then what we can also like put in place for all the child and youth care workers to be able to build a relationship, manage behaviors of the children, and then have all that in place. I think this is going to be a very good one. Thank you.
Thank you very much. I wonder, maybe we can get people to click on raise your hand if everybody's feeling we're on the right track and we should keep going.
Can we all raise our hands if we're getting it?
Hands. That's it.
Hands are
It's
coming
always
up.
a challenge. It's always a challenge, comrades, to be sitting 12 hours the other side of the world doing a webinar and trying to be interactive with you. And I appreciate your involvement and help with that.
I think there's
So,
good feedback here, and people are saying in the chat box as well, 100%, and it's going well, interesting. So thank you.
Okay, so we'll carry on. Let's go back to think about for a moment the variable called siting and physical design of the center, whatever your center is. And think about, if you would, a young person, maybe say 12 to 13-year-old female, is coming to your place on a place of safety order. And I'm thinking about, do they come down a long street or can they come on the bus? How do they find their way to where you are? Would a family member know how to find that place? So to think about, before we've even walked through the front door, that 12-year-old has already begun to form some impressions. And I've learned over the years that it's harder to overcome a first impression than it is to create a good impression as early as possible. It's hard to get over a first impression if it wasn't very welcoming. So to think about the center, what it looks like, how we approach it. Is it on its own, or is it in a neighborhood? Is it big? Is it small like all the other places? And I go to the front door. what happens to welcome this 12-year-old as I welcomed them at the front door of our center. And so be thinking around the way that works. And also to think about, will they be shown to a bedroom if it's a residence? Will they be taken to the bedroom and shown? Will they be introduced to somebody else who will take them? How does that work? And if we're not careful as staff groups running these services, we leave the details of what happens moment by moment in this center to the other residents who fill in what's really going on. So unless the staff see that as something in the opportunity moments available to them to be engaging in how to make the place warm and relational and supportive, then those are really some of the dynamics that we're trying to work with. I always am interested to find that the young people who live in a residential center know every room in the place. And it may well be, if it's a big place, that there's staff who don't know that. So always work on the notion that relational with those who are already there. If you're new, they're the people who are likely to give you the most straight up information. Another thing that I think is important is around the bedrooms. Are they shared bedrooms? Are they shared single rooms in a shared area, different corridor? How are the sleeping arrangements sorted out? And how do we make sure that we know the direction between where the sleeping is to where the food is? And what orientation do we offer in supporting people to know what the food options are that we have? So one last thing that I just throw in, I'm always interested in what happens in the corridors, because there's things that happen in the corridors that don't happen in bedrooms. And I'm always interested in why. And for a time, I also found that there were a lot of events happened outside the office, in the corridor outside the office. So it seemed to be a safe place to get into a bit of trouble outside the office. But think about, corridors are often where a lot of things happen that we need to consider. Okay, I'm going to pause there. Is there anything else? Is there anything about that I've said about the building, the facility that maybe we should check on? Okay, I've got 4.
I think these are old hands.
Yep.
Mine is not old.
Okay, go ahead, Donald.
Yeah, I actually,
Donald.
Yeah, I put my my point on the chat box, but what I'm saying is that I fully agree with what Dr. Leon is saying, that the first impression will last forever in children. Even when you meet the adults who lived in the child and youth care centers now, they will tell you of the first time they landed in a child and youth care center. And they will also indicate to you that, that welcoming made me want to stay, or that welcoming made me run away from that center. So it's very important that we are mindful of that as we receive children coming to the child and youth care centers.
Thank you for that, Donald.
And another point that I made, Leon, was that sometimes when we introducing, like you're saying, children to the environment, we don't we need to recognize where they're coming from and be sensitive to that. Like in South Africa, I made the comment that many children in rural areas would have different ways of bathing. And we often have showers in residential facilities, and we show it and we say, you must have a shower, you know, not understanding that even that might need to be sensitively taught to a child who comes from a different background.
Very good point. Yeah. Okay, so to think about the facility that we have, as one of our real opportunities, that we can make opportunity moments happen, especially if we're relational and make opportunity moments happen right from the start. So we're engaging, we're trying to connect. And so I was always fascinated with one time I went to a secure unit to work, and I was interested that the person in charge, she purposely didn't give them good information to the new residents. And so that way she could figure out who the other residents were that were trying to get into trouble. And the whole thing was back to front. And so that idea that we engage, where the smile, the thing about having some kind of special food even, are all very important little things that can make a big difference. So let me just move on from the siting and physical design of the center to think about
Dr. Leon.
this. Yes.
Sorry. Yeah, sorry, Francisco. Yeah, I'm
Yes.
so sorry that I'm shouting. I think I just want to add something to that, because I felt it, sometimes we find ourselves in this kind of situation where we ourselves are confused and we expect everyone else just to fall in line. And what I mean by that is terminology sometimes plays a major role in where you work. So sometimes I think there's been a move in South Africa towards calling our children's homes, the old previous children's homes that prior to that were orphanages, child and youth care centers. I think there's a bit of that lent itself to a lot of confusion and the way we do things. So your programs don't meet what you actually are designed for. So you know, I mean, you could call a youth center or a child and youth care center and presume that it's actually a children's home, that's a safe haven for children who don't have a home anymore. You know, like that kind of thing. Or we have this cluster foster care as well. And what's the difference between that and a children's home where children are removed from their parental care and that environment where there was a home into a supposedly an alternative care placement setting, which is now a home. So I think many times we have to be very careful when we do want to bring these changes about, what is the outcome attached to where the children are going to be in what particular program. And I know I might be completely off the mark here, but I just feel that there could be many things happening in a center, but there aren't any specific things necessarily happening for the child who has been removed for a specific reason, and then your purpose in that place where you offer this program, it doesn't correspond. So maybe you could give me some insight on that.
Yes. First of all, the first variable about the social mandate, the legal mandate, is so critical to the issue you raise, because if a child is placed on a place of safety order, and for the moment I just want to stay with that one, there are some protections that are built into that legally that we're required to provide a level of relational care and education. a young person who is being referred as a teenager who's a bit of troublesome, they may not be on a place of safety order, but if they're in the same place, you're going to have to plan some separate services. If that's what you were talking about, Francisco.
That's right. And I mean, your children's home that's been turned into a child and youth care center. Similarly, you know, you're sitting with a bit of a challenge there because we have a mixed bag of children coming in. And unfortunately, it's so easy to remove children these days by the agencies, and they are just placed where there is a bed available. I think it's critical that that we you know we understand what it is that we actually want to achieve by having this particular program or project. And again, it's terminology. You know, it needs to coincide. It needs to be. It needs to speak to what you want to achieve by having a child or a young person in that particular program. It can't just be for the sake of a legal terminology that we feel this is what should be happening going forward.
Well, behind every place of safety order are specific reasons that led to that being awarded. So I'm making that assumption that that's a pretty clear one. And there's a lot of times that we may well in our centers not be close enough to what that really means. But it does mean relational care involves a lot of safety, and that safety includes not only physical safety, but emotional safety, safety with social media, for example, are new aspects that come into that for teenagers. So I think we if we have a center that has multiple streams in, I would have thought it was important to have different stream programs that address the particular expectations or needs of those young people. Because when you start mixing them together, then staff are confused, young people are confused, and family members are confused.
Right, right. Yeah. Thanks.
Yeah, good point. Thank you for raising that, because just because we changed the name didn't mean that we didn't have to be zeroing in to focus on opportunity moments in relational care. And that doesn't mean we give them a big hug on the way in. It means that we work actively to connect. Because if we can't connect within the first hours, it gets harder and harder to do that. And the more we are held back, their connection are with whomever your more recent residents might be. And depending on who they are, they can actually give a bad orientation to what it's like living here. All right, so I hope that gives you some idea of how we want to work that. The deployment piece takes us into rosters. How would we work out how many people work on a roster or a schedule where your shift system somehow operates? Can we get some idea of how many would that be? As compared with house parent live in? Yeah, my guess is that there's more shift work now than ever before.
Particularly in government facilities, I think, where child and youth care workers are unionized and they're much more structured around their work arrangements.
But I think also in children's homes, because of the reality that their families can't live in with them. So there's that separation there. And so most of the children's homes have opted not to have staff live in on the premises. And so that is now a shift system as well.
Yeah. Somebody said something?
Lungi, can you mute? Lungi, NACCW, Durban. Mute.
Let me just walk around the thing of shifts and schedules for a little bit. For the longest time, people considered me really strange because I was always collecting the shift roster, whatever they call it, the roster, the schedule, whatever it was. And the main thing that you got to think about is there's 168 hours if we use normal time as our way we usually do things. And we need to think about what happens in those 168 hours. And it often breaks into weekdays, weeknights, and weekends. But day, night, and middle or evening is another way that shifts get sorted. So sometimes you'll have, and I've worked with both union and non-union places, and I have to pledge my allegiance to the union ones because they looked after us better. But the point being that we need to make sure that our shift system is consistent with what's going on in the lives of the young people with whom we're working. So an example we had was we used to have a 7 to 3 shift, a 3 to 11 shift, and an 11 to 7 shift. So those were the 3 shifts that were used. And for a while, the expectation was that everybody had to share. Well, it meant that you never knew for sure who you were working with because there was that you were rostered in, but it didn't necessarily build teamwork. We went through a period where we had what they called a post schedule. It's very interesting because it built on the idea that in our residence, we have some people who are absolutely brilliant morning workers, absolutely brilliant. They can gradually bring young people out of their sleep and prepare them for the day in a very positive way. And when you've worked with people like that, you think they're gifted morning workers, but they're often not very good on a Friday night. Similarly, some people are better evening workers because they're more interested in activity, doing various things and so on. And so it became a way of thinking about post schedule. One was a morning shift, that was the 7 to 3. One was a swing shift, which was 3 to 11. And then there was a night shift. And the night shift, because it was considered important, it meant that the night shift got a 1.1 salary, whereas the morning shift got a 1.0 salary. And the difference took account of the fact that there was more social demand for the night shift people, and that there needed to be some recognition of that. Now, it disappeared, it was gone. What I more find is somebody comes up with a staff schedule or a roster, and they bring it in and introduce it because we use this where I used to work and it worked really well, so we'll use it here. Or another one I found was somebody put together a roster which actually broke up a team. It made sure that some people never worked together, even though they worked well together. So rosters and the scheduling of staff in a shift system can have a lot of interpersonal politics to it unless it's out in the open what we're doing here. And so I encourage more openness about how that's done, and that we have reasons why you're particularly skilled in the morning. We need that. And we need you in the afternoon activities that we want to build and support. So those are the kind of suggested supervision issues that come out when you think about how to deploy staff in the most promising and relational way. Before I move on, does anybody want to react to any of that?
I think Alfred's got his hand up and Donald.
Okay.
Alfred, is your hand up?
Good morning. Thanks, Annie, for the opportunity. Good morning, Dr. Fulcher. Thank you for information. And I was just going to say exactly what you were saying. Is that in terms of scheduling, the scheduling of staff must follow the ebb and flow of the day within an organization. For instance, you might need to have more staff available in the morning and at night than during the course of the day. And then also you must try and schedule the staff around the strengths that they bring to the organization. As you rightfully say, some people work better in the morning, some work better in the afternoon, but you also then will require some of the staff that does specific programs with the children during a certain time of the day. And that is where, and I'm glad that you said that you side with on the labor side, because that is how you want to get your labor units also involved to be able to understand how child and youth care work within a facility, a setting unfolds during the course of the day, and how you have to schedule people as long as you do that in the just take the time that people have to work. But thanks very much for that.
We've got Cindy and then Donald, and then we'll back to Leon.
Yeah.
Oh, sorry.
Yeah.
I see Margaret's hand is also up, Zini.
Okay.
Margaret van Wyk. Yeah.
Would you like to answer one by one, Leon, or you want just a group of questions?
No, let's bring them all out and then we can respond.
Cindy? Unmute. Margaret? Go ahead, unmute.
Morning, everyone. Yes, with shift work, some of the child and youth care workers work a 12-hour shift or 11-hour shift, and some work 8-hour shift. And the ratio depends on, the number of children supervised depends on the ratio of child and youth care workers in an institution. What I also would like to add on, based on your previous information on renational work, is that I think it goes also well with having structured supervision and having child and youth care workers placed in the environment that we can call the so-called unsafe spaces. So that means that, in terms of supervision, it needs to be carefully thought through to eliminate the abuse of children, because especially around the sleeping arrangements. Thank you.
Good point. Good point. Thank you.
Thanks, Margaret. Donald, did you want to have the last question? Or Cindy, if you can speak?
Yes, thank you. Yeah, I wanted to make a comment, and thank you very much, Dr. Fulcher, for bringing this one up. I was having a discussion not so long with one child and youth care worker who was saying they are working on a 4-shift system, and was saying to me, these groups of child and youth care workers have never met. So even though they will do their logging and then they will write some instructions, give instructions, or make them aware of particular children before they leave for the next group, but they don't know one another. And when we talk of relational work, I just find that very interesting, and I wonder what your advice will be on that.
So do I.
Thank you.
Fundamentally, it's essential that residential work be seen as teamwork. And when you end up having all the different shifts, you can actually find that the different shifts make sure that certain people never work together. And so you have a hard time thinking about what levels of consistency you have. And do people compete for different times, or is it every month it's the same, or just rolls over? What's the process once you're into that a 4-shift system? My concern is, and I do know about the 12-hour argument, and there's some people who really steadfastly defend the idea of working 12 hours in order to have a 3-day weekend rather than the other. Interestingly enough, my experience is that those who favor 12-hour shifts are the younger people, and the 50+ people, if they're still around, 12-hour shifts and being attentive at hour 11 when it really is important to be attentive. The research on that says it's not recommended that we have those kind of shifts for work that has potential for high stress. So if we're not careful, we create more stress for ourselves by the way we set up the roster than to work as a team that actually has to work out where our strengths are and how we're going to do this in a way that supports everybody. Because the other people who are watching you are the young people who are supposed to be relationally influenced and impacted. And in those environments, the chances of that happening are not good.
2 other hands up here, Nondi Demuso and Francisco.
Dr. Leon, what I'm suggesting
Yes.
here is that first of all, the children's homes. Sorry. I'm so sorry. What I'm suggesting is that children's homes versus your places of safeties and secure care facilities, those kind of centers obviously operate differently. In the children's homes, there's very, very little chance that you're going to have a 4-shift system. You're looking at numbers, maybe averaging 60 children, and the organization can only afford to have between 10 and 14 staff, frontline staff working with the children. And so obviously that
Covering
kind of
168 hours.
Correct. Yeah. I mean, if you add it up towards the end of the month, it could be between 190 to 200 hours a month that they're working. And so the calculation of 168 hours, I've challenged that many times because an admin person works around 173.33 hours per month. And how do I get to that? You see, you have to do the calculations obviously differently, but I think it cannot be compared because in some cases the argument would be in some labor kind of situations that you're supposed to work like 40-hour week and the other one says no, 45-hour week. So there already is a difference. So, but I think at the end of the day, in a children's home setting, what you're looking for with a kind of shift system is to help the staff not to be overworked. Firstly, and when I say that, when your staff member comes on duty, let's for argument's sake say on the Monday, in our particular case, they leave on a Wednesday, which means they live in with the child. That already is a big difference. Now, when you talk about relational work in that particular sense, you can then see the value of having the staff member there a little bit longer, right? Because they stay on the premises, they leave and they have a 2-day break, and then they come back and then they work the weekend, then they have another 2-day break. So every second day or on the 3rd day of every shift, that's when they switch, and you're able to achieve more in terms of your programs and the contact between child and staff member than when you were to have a shift system where you work in the morning from 7 to 3 and then from 3 to 8 and from 8 till 12 or 2 o'clock the next morning and so on and so on and so on. And I've had the opportunity to work in both settings before. but I do think we need to understand that obviously it's going to be different in a children's home compared to a child and youth care center, like a place of safety facility or a secure care.
Yeah. Yeah, I agree. It has to be tailored to the particular relational needs of the young people you have.
Right, right.
Yes, yes. We've got Nondemuso and Cindy, if they could speak, and then I think you can go on after that. Leon, please unmute.
Yeah.
Morning.
Go ahead.
Good evening.
Okay.
Oh, morning, Dr. Leon. How are you?
I'm very good, thank you.
I just wanted to know, each care worker, how many kids should we work with in a center? Because here in our center we have 45 kids, and we are only 5 care workers. So I just wanted to know, how many kids should one care worker work with?
You have how many kids?
45 kids.
With
And
how many
5
staff?
5 care workers.
So somebody would work at a ratio of 1 to 8?
Pardon?
Is that your ratio, 1 to 8?
Somebody would work at a ratio of 1 to 8, which is the number of residents divided by the number of staff.
The staff is divided. We are working as a shift. 2 care workers per shift.
Yeah. What I purposely did what I did there because when you answer the question, which is how many staff should you have, with the number, how many children should each staff member have?
Yes.
It's very complicated. But somebody would say that we've got 40 residents and we've got 5 people. We need to be able to work that out. That's a ratio of 1 to 8. So the cost benefit is that we would need to argue for what happens, what would be involved to bring that down to 1 to 6.
Okay.
Well, my own view would be that we need to have some pretty high level of need to be able to move a ratio down to 1 to 6.
Okay.
I think 1 to 8 is workable, depending on how we work it. Sometimes we can organize ourselves to not be very successful.
Okay. Okay. Thank you. Thank you.
Sorry, I couldn't answer your question because I've been in some places where you had 1 to 40.
Yes. Thank
Not
you.
a good option. Yeah.
Okay. Thank you. Thank you.
So Cindy now.
Cindy, are you going to speak? Or Johannes? I think Cindy keeps putting up her hand, but her connectivity is not working. I think the question she raised in the chat box is that we are facing challenges of not having uniforms and not being paid allowances, and our work is not easy. Please assist. That was Cindy's comment in the chat box.
Yeah. Well, it's true. The job is not easy. I've never worked in a place where there was a clothing allowance. Uniforms.
Johannes, mute, please. Sorry.
So I don't.
Yes. Johannes and Lebo Kang, do you want to speak? Either one of you, please, quickly.
Okay, thank you. I just want to in on the shifting and then staying consistent with whatever, like when it comes, especially when it comes to routines that have been set up in your corridor or cottage, and the rules, everything, you know. So what we've sometimes find ourselves as child and youth care workers, we sometimes says no, as Lebohang, I've got my own style of working with the young people, and the other one comes. Sometimes that confuses the child's mind to say that no man, but on the last shift, this is what I was told, and then now the next coming shift. Now, the other child and youth care worker coming up, you know, there's different styles. So that's where sometimes that we get children acting out, you know, because of the different routines that are coming up by different people coming up. But now staying consistent, saying that when we report off, say that now it's time for me to log on. Okay, this is what I previously did next week, and then the upcoming child and youth care worker take on to what I've done. That will actually manage well the behavior of the children, making your corridor to also the workload, to be more easier and lighter, other than having to work ourselves out and burning ourselves out. Because if we're gonna say that I'm gonna come up with my own different style of working, and you're gonna come up, that's where we're piling up the work, and then that's where we're burning ourselves up. If I totally agree with you, Dr. Sir, there, when you say that we need actually to keep in mind that we need to stay consistent with whatever that we do in our corridors and then in our centers. That is actually like speaking in a perspective of the residential, yeah. So we need, as child and youth care workers, to stay consistent with whatever that we do. Thank you.
Thank you, Leon. Maybe you can respond to that.
Yeah, El-Marie is absolutely correct. Children are clever, and they can see when the team is not working together. It will cause havoc. Yes, it's not safe if you're all playing different differences and you're not talking to each other about what's going on. Then the children are going to play one against the other, and that's not relational child and youth care. We have to think about relational child and youth care is not only something that we do every day with young people, but we also practice it every day with the people with whom we work. And if we don't include the second part of that, then I would argue that we cannot do relational child and youth care, because it ends up being me, and I don't care what they did, or their influence isn't important, and it is. So in the course of every week, there needs to be built in some time. If it's only a half hour, then it's carefully managed half hour when people are together in the change of shift, and they're not just writing notes, they're actually talking to each other. And you can talk to each other in a hurry, because you can't just walk on and on and on in a half-hour changeover. Think about the people in fire and emergency, or people who are having to work with crisis and trauma. They can do that. They have to talk to each other, but they don't have to go on and on and on and on and on about it. They need to be focused, work out what we're going to do, and leave it. And know that somebody else is going to follow it up and pick it up. And we're not going to be playing one kid off against the other between staff. That can't happen. And if it happens, then the staff have to take responsibility for it. Not to blame somebody, but to say, come on, get on with it. This is relational child and youth care.
Yes. And I just wanted to add, maybe have we been creative enough in looking at how could we connect with each other virtually? I know we write notes, and that's not maybe good enough. And I know that we can't always meet, but surely there's ways in which we've learned now since COVID to be much more active virtually. And that might be a way of actually talking about handover with the child. It's just an idea. I'm not too sure if others have started to look at that.
And we use SMS. Why not use SMS?
Yes. Yes. Johannes,
okay,
do you
let's
have
move to the.
Okay. Go
somebody
ahead.
else.
There was Johannes on. The others, I'm just going to ask you to hold on. Johannes, did you have the last point then before Leon goes on? Cobus, you'll have to wait for the next round.
Okay, thank you so much, Dr. Z. I think I'm Johannes Solo from Northern Cape, Child and Healthcare Worker, but now I hear most people are talking about the residential. So for me now, it's a different doctor. So I want to understand, because we're working in the communities. We are not centered in where the children are being put together. We are based in the community where we do door to doors, and the routine that we follow is the routine that every day you must attend office and you must attend clients or children. And at the end, when you speak about the rational, it confused me, because at the end you need to report more than 30 children. So now I'm asking myself, when I get this information, did I provide quality services to these 30 children? Because the department will be telling you that you need to submit at least 30 children or more than 30 children that you must service each and every month based in the community. And you must remember, you are meeting children with cultural differences, with different behaviors. Some of them, they don't want to talk to you, but you could see that this child needs services, but and you need to provide those services and to report about that child. So I think for us now, where I want to understand now, I'm based in the community. I'm not based in the center. So now, how do I go about in providing quality service towards those children, especially different children that I have to do visit. Some of them we do educational support, psychological support, all the stuff. So now it's going here now. Sometimes you get frustrated, because now you have your own problems. You meet these children, so there are many, more than 30. So now that's why I just want to understand that part, because I think for us, always child healthcare workers who are in the community, we see those who are working in the center. For them, it's easy because the children are based in one place. They are just focusing on these children. It's different from us, where now you need to go to door and provide those services. Thank you.
Thank you. Thank you, Johannes.
I think it's really important that what you said. I agree, it's different. But the person who is living with those young people is facing different challenges than the person like yourself who is coming from the outside in or making contact. So both have their own challenges. The real issue, I think, as an outside person coming in, is how do you engage and how do you make some connections with the young people, and you have to make connections with the people who are there with them because their carers are there. So the more you can make that connection both ways, staff and young people, in a relational way, it builds on the next visit you make and the next visit you make, so that you're, I one time suggested that young people, they invite their social worker to come for lunch. And it just happened that my wife was also working in the place, and over coffee, she heard social workers talking about, well, if I went for lunch, what would I talk about? And so the whole thing about sometimes we don't know how to engage in relational opportunities, both with the staff and with the young people. And in the role you have, that probably is going to be an important one.
There's a nice conclusion to this, Leon, in a comment made by Jabu here. If a clear protocol is written on handover and childcare workers have that, maybe it would work, because nurses and hospitals take time to give reports to each other before new shifts.
Yeah. We can learn from nurses, and nurses can learn from us, but it's really important we think about that handover of information, and it's not just written down somewhere. Well, there's some really good stuff in the messages in chat. I hope that whoever is going to help collate all that together, because the material, I would have thought we could probably publish in social and child and youth care online.
That would
Anyway,
be
let me
that would
just
be
pose that.
wonderful.
Yeah. Well, let's move to variable 4, which is the fourth one. So we've talked about the place. Here we come. What's it look like? Then we've looked at who are the people who are there. Now we need to think about recurring patterns in the use of time and activity. And here, Francisco, I'm going to say we've got to hold on to 168 hours of a week. And that's based on the time principle of 24 hours times 7 days of the week. And all I have to do is to go to the television programming for any country, and it will have the programming set out in that way. And any roster that I've ever seen also covers the 168 hours if it's a residential place, 24 hours. So it might be that we have live-in staff, or we have live-in sets of staff. So like somebody mentioned earlier, we may have somebody whose family are living at one end of the center, and they are involved with the operation of that center. And at the other end is another relief couple, and they work that out over the course of any week and how that works. So 168 hours broken up to 24-hour segments is usually the way we have to think about this notion of what are the patterns in the use of time and activity. Well, one of the first patterns that's imposed right away is the difference between Sunday night and Monday morning. Monday morning usually involves school. So if we're not too much looking at it, most weekdays for young people, there's an expectation that they attend school during those periods, usually between 9 and 3. So suddenly, and somebody mentioned earlier, you don't need so many staff on at 9 to 3 if they're at school. So bear that in mind. So we think about weekday, weeknight, or week coming out to the end of the weekday into the weeknight. And the amount of transition, social transition involved with moving from weekday to weeknight is really quite different from Monday and Tuesday and Wednesday and Thursday, which suddenly changes dramatically on Friday. That is, if you live in a Western country where things operate Monday to Friday and then have the weekend on Saturday and Sunday. When I lived in the Middle East, the days were different and we had to plan accordingly. So we get this idea that we need to account for the life of the young people with whom we're working and what happens in their life outside these times. So in the evenings, we have what, homework, or what kind of activities go on between 3 and 4 in the afternoon through to about 9 to 10 o'clock at night. And it's important to figure out what we have planned in the way of activities and purposeful activity that creates notions that are in there. Sometimes homework features, sometimes activities, outings and whatever. But the important thing is that we acknowledge that there's a key social transition between weekday into weeknight. Similarly, from weeknight and weekday into weekend. And what weekend means for the young people with whom you are working. And some of them, that may well involve a church activity on a Sunday morning, or it might be a visit to a mosque on the Friday. So depending on how that figures, we need to think about the purposeful use and recurring patterns in those use of time and activity. I remember one time back when I was a little younger and a little less, a bit more naive. We were working in a special unit for maladjusted teenagers, a Bernardo's facility for, that was the terminology, maladjusted teenagers, which meant that these were capable young people educationally who were struggling with family and social issues. So we as a staff group spent time talking to each other about what we're going to do, and we decided we would have offer a group meeting for the older teenagers on Thursday evening, because Thursday evening fit well with our timetable and our staff roster, and everything looked good. And on Thursday evening, the first time it was supposed to happen, they didn't turn up. But they were nice to us in our naivety. And they actually said, well, actually, Thursday night is Top of the Pops on the BBC television. And as long as we can go to another night or after Top of the Pops, then we're quite happy to attend your group. So it taught me a really solid lesson, which is make sure we're in touch and communication with what's happening with the young people in their timetable. And so our timetable to help them fits with their timetable to be available. And so these are some of the issues that come in as we think about the transition times that happen in the life of a home. The other thing about transitions, stop and think about it very often, is it's during the transition times, change of shift, transition from school to evening or from evening into the weekend, it's transition times that we often find ourselves having to deal with crisis events. Or maybe they're not crisis events, maybe they're events that could become a crisis. But things can go wonky if you're not careful during these key transition times. So everybody, I think, needs to think about that for their own service. What are some key transition times that we really need to make sure we've got to focus on? Because when we don't pay attention, these are the things that can happen. And so I encourage people to do that as a matter of routine, just to think about, okay, how are we doing with a new group, new term, those kind of things that come up. So recurring patterns are what happens in the course of it. You begin to find out how influential food and the preparation of food and after food is a very significant feature of the 168 hours of care in any residence. So food opportunities, and not just seeing food as something we do to make sure everybody's feeling okay, but food and opportunities to have special meals, to make sure that we have a birthday cake for each young person, that we know what their favorite food is if we made their special meal, or have we offered and had them help us make it for the people in our hostel. So a number of ways in which we can use those opportunities, I think, many more than we stop to think about. Does that spark off any thoughts from anybody? Recurring patterns in the use of time and activity. My experience is that most residents that has South African young men, they're interested in when the football kicks off. Hmm. Anybody want to ask a question about that, or what should we do?
Any comment from anybody? Any question on that? The routine activities?
I think I maybe just want
Transition
to add.
times.
Can I add in there?
Yes,
Maybe,
go ahead.
maybe just to that we stay focused on age appropriate activities as well, because that can also influence your day. And I agree with you when you say it should actually it should be about the child and not about the child and youth care worker that's on duty. How you shape and how you design your programs.
Yes, it's a good point that, and Caswell's here. Caswell, you may make your point.
Yes, my comment here, it's when Dr. Leon said that the crisis event or the potential crisis need to be managed during transitional, because when we work with these children in residential care facilities, they are very good in creating crisis when they realize that the other shift is coming in and the other shift is going out. So they can be very creative in manipulating that process so that they can prevent their routines to be taken care of. So it's very good to manage that period during the transition as well. Thank you.
Thank you for that. We can also think about that as resilience. That
yes.
Young people are very able to read what's going on with the new shift coming on and who's around, and they're often very much into who's on, checking the roster if they can, asking the questions. So I guess one of the questions that I'm going to be posing for us is the extent to which this offers us as a profession, and I'm now speaking to professional child and youth care workers, who can actually talk about the way our services operate and have a framework to be able to communicate that. And that we can do relational child and youth care practice with the young people and with the staff with whom we're doing relational child and youth care practice. That the two go together. Fundamentally, residential work is about teamwork. I'm interested if there are any participants who may be involved in supporting child-headed families in the community. Is anybody doing any of that? Because that's a really important piece of work.
Yes. Community child and youth care workers, are there any of you here who can make a comment? And just to say, Leon, as well, that we've got Izibindi Izikulene. There are workers around here who are school-based child and youth care workers and dealing with the kind of routines in schools. Yes.
Good. Johannes.
Go ahead.
Okay, thank you, Doctor. Yeah, I think for us being in the space in the community, it's easier for us because now we're working with the whole family. Every services that we provide including the families. The child is not separated from the family. The child is not separated to his friends, the surrounding, the environment. So because we are even able to go to school, to go and check the progress of the child with the parents. So I think for us, it's much easier to involve every player in the child's life, because it's very important, because even if you visit the family, the first thing that you need to do, you need to speak with the parents. You need to understand how the behavior of the child is being. Then now you can now come and speak with the child now. So it's easy for us to provide those services because we are based in the community. So we are. I think it's going to be different, because I think if the child has been removed and it's in the setting of the residential area. So he has been the relationship between him and the parents is lost. But for us, we are bringing this child, we are building this relationship with the family. The family understands the services that we are providing. Thank you.
Okay, we've got Jabu
Thank
here
you.
next.
Yes, I also wanted to actually make a point. We work in school as the ECB Nezikolweni. So when we get to a school, there's a standard routine. What time they come, what time do they come to school, lunch break, your after school. And what we also pick up, you will find learners that are coming late to school. And we do what we call your gate duty early in the morning. And we are able to actually have that conversation with those learners who are actually coming late. And, it also helps us to help them understand that routine process. During class time as well, you'll find other learners are actually in class, but there are others that are actually bunking classes. So it also creates an opportunity. So we do what we call your corridor supervision around, and it creates an opportunity of life space work where we engage with young people and actually try to find out what's the reason of these learners actually staying outside. Is it the issue of them not writing homework, who could be included in our group activities, doing homework supervision? So it also actually helps us to blend in easily with those routines in school. Thank you.
Very good. Thank you for that. Very important. And that's a piece that is missing in many places.
Leon, someone in response to the handover made an interesting point here. Memoria says that, always explain to children that you have colleagues who do the same job you are doing, colleagues who are bound by a code of ethics and are professional too. Doing that will help the child to seek help from your colleagues when you are not available, and respecting each other as child and youth care workers. Of course, we're different and unique, but we are bound by a common practice and a common code of ethics. I think that's quite a helpful point. And two other points that came up here was that, it's the individual development plans that we have for children that also helps in, I think, handover. We know these particular plans for children have to continue in handover, and that would be important to respect.
I think really important piece for us to remember in making our notes at change of shift or handover or whatever in our individual development plan or whatever. Important thing to remember is to put in things about achievements. And if we're not careful, it's very easy for these reports, when young people have gone back to look at them, where it caught up all the troubles they got into, but it didn't really acknowledge the achievements they made and the achievements that really were important to them. So I always work on the notion, if we can't identify 2 or 3 achievements this week, what have we missed?
Mm-hmm.
And I'm not talking about big achievements, but sometimes as little as being able to tie your shoelace, or to be able to use the public bus system, variety of ways in which, tailored to each individual person, they make achievements that we need to record and acknowledge and celebrate with them to some extent.
Leon, I just see there's also someone commented about they are working with sentence youth, secure care centers, and that's a different setting from the old children's homes. The comment is here, for us in sentence youth, it is not easy because their parents visit us after a while. It's only calls that helps. I don't know if you would like to comment on that, on those that work in that setup as well.
I think I really can identify with those kind of issues. Working with young people on the sentence is is following the pathway that got them there. And usually the pathway that got them there involves other people who were on that path with them. And so I think there's a really vital piece about reaching out to parents with young people who are on a sentence, because they themselves may have once been on sentence as a sentenced youth. These things have a history of repeating.
Gugu, please mute. Gugu, please mute. Thank you. Sorry, Leon.
Yeah, so that idea that it's harder to engage with those parents, but all the more important that we do so, because they often were the parents, had a lifestyle that is like the young person that you're working with on sentence. So when you've got that going on through at least 1 or 2 generations, you've really got to engage in both the parents where they are, if you can, as well as the connection with the young person. And sometimes the young person actually decides, if we're working with them and they've got some capabilities, make decisions that are not to be around that parent. And I've seen that happen with some success, but yeah. Keep working at it. Don't give up.
Thank you. The other transition that the school-based workers are talking about here in Izibindi, Ezikuleni, when children move from one school to the next, particularly when they starting high school, they're moving from primary to high school, talking about preparing them for the challenge that they might encounter at that time. Because when these learners face these challenges, they've already had the guidance and support so they can make informed decisions. It's always a difficult time for children.
Huge time of social transition. It may be one of the most important socially endorsed public transition that we make.
Mm-hmm.
I shared the story about from the small community that I live in, which is almost all Maori in this community. And there are about 24 children in the local school, all Maori. And the point is that school goes from primary through to grade 8, at which point they have to go to a secondary school, and the nearest one is an hour's bus ride away. So what we can already identify is that as a young person begins to miss the bus with rather more regularity than others, they're almost predictably preparing for their leaving school early and not having any educational benefits from it. So your point about transition, I want to add, is really important if we're talking about rural kids.
Yes. Yes. And it's very important to strengthen children so that they know how to use this time now, that even the time on the bus to be constructively used, and how to manage themselves in an environment that is new for them. Yes, I think that the other transition we often find is the after school, that from the time of leaving school to getting home. I think that some of the research is showing that the largest numbers of teenage pregnancies happen in that period. A lot of the gang fight, a lot of the bullying on the street, and so it's an important space to observe and to protect children in.
Absolutely. Yep. And if we're not careful, it's a time when they themselves are wanting to escape observation.
Yes.
So it's recognizing that there's something there that, dare I say, that each of us in our youth may have done some of that. But the point being that we need to be vigilant. And maybe that instead of being nosy, I would like to be thinking vigilance is important. And I've said it one time that I may not be able to grab you, but if I can race ahead and try to catch your foot before you stop into getting into that mess further, then I've done what I can.
Mm-hmm. Yes, yes. There's a nice comment here before Memoria goes on, which is about, I think, like rites of passage as well. When children reach a certain age, they can transition into certain programs. But traditionally, and I'm asking the group this as well, there are rituals and customs when young girls come of age, and there's ceremonies for young men that helps with the rites of passage. How are they respected in childcare centers, for example, when they're so far away from family that would do the traditional things? How do we accommodate that? Has there been any good ideas about that we could share? Because even on the chat books, as you say, there's such rich information that could be helpful to us. But that was my comment, and I'm just going to ask Memoria to make her point. Go ahead, Memoria.
Okay, thank you. Memoria. Okay, in high schools, we also have a routine that we do as child and youth care worker every year when we welcome the new learners for grade 8 to grade 8. So it's whereby we call all the new learners, the grade 8 that come from the primary school. So we will discuss the negative and the positive part of the high schools, and we also involve of the 3 to 4 grade 12s so that they can talk with they talk with the grade 8s about the negative and the positive expectations in the high school so that we can prepare them. We also, as child and youth care worker, we introduce us as child and youth care workers, what is the child and youth care worker in schools for grade 8 so that they can know when maybe they need a guidance or maybe something like issues, social challenges they are experiencing so that they can come to us so that we can help them. Yes, it's our routine every year, January.
Thank you, Memoria.
Thank you for that.
Johannes?
Okay, thank you, Doctor. I think the right of transition is very important, like the doctor is saying. Especially, remember, for us as we are involved in the communities, when you approach the family where you're going to deliver services, the first thing that comes to your mind is that you must remember that we are all enshrined in the constitution of our country, and we all have the same rights as these children and these families. So you need to respect whatever rituals, whatever these families they are doing. And as a child and care worker, you need to support them. Even if you don't practice such rituals, remember you came here to support these children, to support the child, or to give services that are needed in this family. But any rituals that are being done, remember that they are enshrined in the constitution. So you cannot choose for the family. You cannot come decide for the family to say this family you must do this. You don't need to do that. No, it's up to them what they do. For you as a child and care worker, you need to respect, knowing that we all have rights under the constitution of our country. Thank you.
I support what you were saying mostly. And here's the bit that I pose the question. And that is, if I see or am aware of something going on in that family that is leaving this child vulnerable to safety, then no matter what I do to sort of facilitate, I really need to bear in mind that if this child is vulnerable, I need to do something about it. So that that's my first thing. The second thing is that we've not talked at all about the notion of safety as applies to social media with the young people in our places. Is that a can of worms for another webinar?
Definitely. Definitely. Jabu?
Yes, just to add on the point you are discussing, we are also guided by the best interest of the child. So in our assessment and IDP, that is always in our discussion with parents. So if we see that whatever that is happening there and it's not in best interest of the child, then we try by all means to ensure the rights of the children of the young people are upheld in that process. But my point was around transition. As my colleagues have been saying that, we assist with transitioning from primary school to secondary school. And if we have secondary schools that we have ECB Ndezikolweni child and youth care worker, we are able to actually have that conversation and to actually help these learners who are moving from our primary school to monitor this transition of these learners and actually support. And what we also do in that process, we do a handover, because some of those learners are child protection learners that we need to track. They are handed over to the secondary child and youth care worker to ensure attendance, to ensure that they are part of group activities, to also ensure that they are well supported according to the IDP. So that's what we do around transition in schools.
Good. Thank you for that. Well, I posed the thing as a closing about social media and the extent to which we address the safety issues and learning associated with digital natives, people who are using social media well before we ever did in our age. And so that one is there and still with us. And I'm not sure that we've really taken it very far as a profession. And a lot of attempts to say, well, you can't have a smartphone, and that doesn't seem to be very smart. Anyway, that's where we are. We've come to almost the end, if I'm not mistaken.
Yes, and I think we're going to go. Okay, Ellen, go ahead.
Thanks, Amy. Yeah, thank you, Dr. Leon, for sharing. You said you conclude your presentation. I don't know if there's maybe just the last question before we go over to the vote of thanks. I don't see any hands in terms of.
Can I make a comment?
Yes,
can I make
Jenny?
a comment? Leon, I think I heard you earlier say that there's lots of rich comments in the chat box, and maybe we could get an article from this. I wonder if we could take that forward, that we download the comments, and maybe even if you wanted to have a small discussion with a handful of people who had made comments that you would like us to coordinate around you and just add more information and maybe assist us, because we'd like to see the webinars advance to something in writing. We haven't done that yet. That would be the first opportunity. So that would be special. Let's do it. Okay.
And I'm sure Martin Stabery would love it.
Yes. Thank you. I'm happy to help coordinate that. Thank you.
Somebody asked, where can we get the article? I think that Melanie circulated it all over the place, including Facebook.
Yes. And we will forward it to everybody as well. The article, many people have asked for that. We will forward it. And this is a recorded webinar, so with the link.
All right. Well, thank you, South Africa. We miss you.
Yeah, Dr. Leon, before we gonna let you go and have your night's rest, we just want to say thank you for your time. But most importantly, if I can just summarize, I think from the comments here in our chat box, we could see that people enjoyed, and it was for them very interesting, to participate, because it's a long time since we have spoken, especially about residential care, and I think you have also just come and make us aware of the importance of our relational child and youth care work, as well as the importance of how we should deal with children that are in residential care. Because one of the main challenges that we have is from government side, always they ask about the costing of a child in a residential care setting. But we also listened, and we know that it's important. Some children, as you have shared with us, it's about the school, the community, the family, where the children comes from, that they need this type of support. But we will call now on Lebo, our youth coordinator from the Western Cape, just to come on board to do the official vote of thanks to our guest speaker and also those who are attending this webinar. We apologize for Jonathan Gelderblom from the Southern Cape. He had a double appointment today. So Lebo, if you could just unmute and put your face on the camera, please.
Okay. All right. Yeah, I thank for the opportunity. Dr. Leon, first of all, I need to say thank you to you, sir, for coming up on board and then sharing the information for us. I think this is has been a really webinar, and very of both child and youth care workers in child and youth care centers to the community, and it's actually a site that we know now actually what is it that we do in order for us to manage those behaviors of those children that we're working with, and then actually the young people that we're working with, and also to build a relationship around them, and also so that we can even help them, like there's conversations that came up and saying that we need those young people, they adapt from us as older people, so that they can be able to build relationships as well with other young people. So this has been a very helpful in all the child and youth care workers around the world listening today. It's actually what we're going to take on and then start, putting it in place. Thank you very much, sir, for having you on board. It has been good. To everyone that has attended also as well, thank you guys for being part of this webinar. And it will part up to all our colleagues, Muslim colleagues as well. Thank you.
Thank you very